Are you able to see it?
Yeah, doc.
Cool. So I'll be talking about Plab in general and the current hot topic about UKMLA and the pathway in general. So what I'm going to go through today is basically I'm just trying to give you an overview sort of what I'm going to cover, just so you have an understanding of what this session is all about. So first I'll just give you a bit of an introduction sort of what Plab in general is for those who is just you know opening your eyes to about what a journey to the UK is, and then criteria about sort of who needs to take these exams, and then the basic eligibility sort of that puts you at the beginning of who needs to take these exams, and then a basic structure sort of what the exam is all about and the parts of it and the intricacies of these exams, and how you sort of plan your entire journey right from your medical school and then up to the point of you reaching your first and job in the UK, that is in the NHS. And then the most important thing is basically trying to gauge the amount of expense that you might incur in this journey until the point you reach get your first pay slip in your hand. That is very essential for you to gauge and understand this entire journey before jumping the gun and taking the journey ahead. And then after that, I'll be touching a bit about UKMLA and sort of the confusions and the most commonly asked questions revolving around these topics nowadays. And then just give a comparison sort of why I chose or why generally people choose UKMLA or Plab pathway with regards in comparison to USMLE. But it's totally my personal perspective. Each individual has their own opinions on it. And then in to close with, I'm just gonna talk you through my journey in my personal experience, sort of how I started off thinking about this journey from my medical school, and then what happened through my process of these exams and coming to the UK, and the turmoils I experienced, and my current situation right now. Hopefully, it will give you some insight, sort of make your decision at this point in your internship or during your final years. And I hope you find it helpful. So please feel free to jot down your questions or put them on the chat box. I'll try and address them towards the end of my presentation. Just to start with Plab, so basically it's just a licensing exam. So people might confuse it with saying that is it some kind of a qualification or is it a degree? No. To put it in simple terms, it's just an exam or to give you a license to practice in the UK. And it's only one of the ways to get into the UK medical practice or UK medical register. There are various other ways in terms of postgraduate qualifications, in terms of MRCS, MRCP, membership exams. So today I'm only going to focus on the Plab route, which is the immediate route after your internship or which you can take during your internship after only finishing your undergraduate degree. So who needs to take this exam? Essentially, all of the international medical graduates who finish their medical schooling outside the UK, um, European, outside the European Union or Switzerland. So EAA encompasses European Union countries and also Iceland, Liechtenstein, and Norway. So those who finish their undergraduates in the European Union are allowed to practice in the UK directly without any exams. So coming on to the main topic, before you jump into preparations and worry about what to prepare, what not to, what are the do's and don'ts. The main thing here is why I'm pressing too much on this is because I'm told that I'm addressing mostly international medical graduates who are doing undergraduations either in over mostly in overseas outside UK, like in Philippines or Ukraine or Georgia, because first thing you need to do is my medic think is my medical degree, the degree that I'm doing currently, is it recognized by GMC? For that, you need to go into World Directory of Medical Schools, which is essentially a website which has like a library or a catalog which has got all the medical schools which is being recognized by GMC. So try and put your medical school details in that website and see if your degree or if your institution is in the first place is recognized. The second eligibility is as all you know, IELTS or OET. So essentially, you need to get 7.5 overall, and then a minimum of 7 in each domain. And if you're not taking IELTS, there is an alternative which has been recently introduced since 2019, which is the occupational English test. Under the subsection of medical, you can take OET as an evidence of English language, and you need to get grade B in all the domains. One final note which I'm trying to add on here, which is essentially not an eligibility to take Plab 1, which is basically uh, a mandatory thing for you when you're applying for a GMC registration after passing Plab, which is trying to make sure the internship which you're doing currently is actually accommodated under the acceptable pattern of internship. So there is a certain structure that the GMC suggests or follows to make sure your clinical experience is adequate enough to provide the GMC registration. So make sure your evidence of internship is acceptable. Essentially, there are certain criteria to do, like 6 months in medicine or 6 months in surgery. Surgery doesn't essentially encompass just general surgery. It includes orthopedics, ENT, a lot of specialties. So GMC in their website has a specific subsection called acceptable pattern of internship. So I would recommend you to go through those criterias. But if you're in any confusion, always email GMC with your internship certificate, which a couple of my friends have done from universities like Singapore. And the GMC is very prompt in response, and they do advise you sort of what to do next. So this is essential for you to before you jump into this journey. So the next question all of you will be thinking right now is, what if my medical school is not enlisted in this World Directive Medical Schools? Yeah. So try not to panic. So first, make sure there's another link on that same website, which has a list of medical schools which is not which is very clearly suggested that they don't accept medical degrees from these colleges. So make sure you're not in that list. And if you've got any relatives who are enrolling in Ukraine or in China or wherever, try to make sure they don't enroll into those undergraduate schools. And hopefully the medical school which you guys are doing right now is not in this list, which is not recognized. But if it's not found on the directory as well, there is still a chance for you to register your medical school under the World Directory of Schools and get acknowledged by the GMC. A very close friend of mine from Tamil Nadu did her undergraduate in Velamal. I'm not sure if you know. It's like a private medical college which is deemed under which is under the MJ University, which was not recognized in the year of 2018 to 2019. That's medical school was not there on this list, but then there is a process called raising an inquiry with GMC. And if you send an email saying that my school is not recognized, not found in the directory, and then they will send you a form called PMQ form. Essentially, just it'll have like a prerequisites of filling your personal details, attaching your medical degree, and then if it all fulfills the GMC requirements, your school will be recognized, and then only will you be able to create a GMC account to book a Plab 1 exam. I hope that makes it clear, but feel free to ask any question at this point, because this is really important. So I'm going to pause for like 30 seconds if you have any questions at this point. Any questions with regards to enrolling your medical school if it's not there on the world directory with the GMC?
No, doctor.
Okay, fine. Thank you. So going into the Plab exam in detail. So Plab in general has two parts, as you know, part one and part two. Part one is essentially a multiple choice exam, which can be taken in the UK, outside the UK, overseas. It's essentially like an online exam, which has got multiple choice questions, and you're not negatively marked. It's basically a 180 questions, single best answer, multiple choice. You've got 3 hours for it. Essentially, it covers your undergraduate topics like anatomy, and then clinical bits like third year, final year exam topics. So it's fairly simple exam, and the pass percentage is quite high. And the most recent statistic shows around more than 70 to 75% of students who take these exams pass in the first attempt. So moving to Plab 2, this is like a OSCE-based exam, clinical skills evaluation. Basically, it just tries to evaluate your patient interaction, patient communication skills, breaking bad news, how you manage a critical scenario, resuscitation scenario. They have simulation mans like a dummy, which connected to monitors. They might assess you how you treat these patients in various different settings. So basically, it's got like 16 stations, and this exam happens only in the UK, where the GMC headquarters is, which is in Manchester at the moment. So essentially, as I said, this scenarios aims to reflect real life settings. So if you talk to a lot of doctors who finish this exam, this will almost very closely reflect your practice in the UK. This is all of the new stations that come up in these exams are basically the scenarios that you face as a foundation doctor or an SHO. Uh, so even if someone who's like postgraduate doctor, or like someone who's not finished membership exams, who wants to get into UK medical practice, if they're taking these exams, they need to think, put their put their feet in the shoes of an F1 or an F2, think in terms of a junior level, and then decide your management plans. So put it into simple terms, it's like a clinical exam. You've got a lot of academies in the UK where they train doctors, and then you've got a lot of mock exams. It's very hands-on, and it's quite a simple exam. So that's all about the exams in general, the part one and part two. So you might be thinking right now, so what the entire journey entails. So is it just the exams, or I just finish my exams and come into the UK for my job? No, it's just kind of planning the pre and post part of your exam, which is very vital and essential. So I'm just going to give you an overview, sort of what it is. So I kind of looked at this flow chart, and it's quite useful. If you have time, just go through this website called Road to UK. When I started my journey, this was a very preliminary website, and there were two couples who are working in Plymouth in UK. They are international medical doctors from Bangladesh. Um, they started off their journey as an SHO. When I was start looking at Plab journey, it was a very simple website. Didn't have much of information, but now it's very detailed. You have every step of explanation in it. So essentially, what you need to do is first try and finish your primary medical qualification, which is the first essential criteria, and make sure it's recognized. If not, you need to do the steps that I've told you already, and then so there are two things after your undergraduation. So if you're thinking about going back to India, like if you're thinking of keeping the option open, you're giving your FMG exams. But there are certain universities in Georgia, or like in outside in the international areas, where certain internship are not accepted. So make sure you communicate with GMC. Uh, for example, one of my friends who from Singapore, his internship was not accepted. There are certain intricacies in it, so he had to write the FMG, get the Indian internship done, and then it was accepted. So try to make sure your internship is accepted, and if not, if you're in your preliminary stages like third year or fourth year of your undergraduation, now they have opened up applications for the entire foundation program, that is FY1 and FY2 in UK. So even after completing your final year MBBS, you can directly apply for foundation year training without doing internship in your overseas medical school. That is also an option that's recently opened up. So try and look into that. But let's say most of you are interns right now, yeah? So let's say you finish your internship, you need to do something called EPIC verification, which I'm sure most of you, when you've attended the USMLE webinar, they would have talked about getting this EPIC ID. So essentially what it is, to put it in simple terms, they're trying to electronically verify if you're giving a proper valid uh, MBBS degree certificate or not. So it's just like a payment, and you have to send your degree certificates to them, and they'll verify it with your passport and all those stuffs. You get your Epic ID. That's very essential for you to do get your GMC license as well, which is as equal important for your USMLE. So after that, you can do your IELTS. You could do it in your internship. I would suggest do it in your internship. I did it during my internship. Uh, Personal experience, I would suggest take OET because IELTS is a bit tricky exam. It's all I'd taken it for like two times and I couldn't match the writing area. They judge you mostly on like grammatical errors and stuffs, and you would be breaking your head like, why would I have to become like an English professor to get into uh, a higher score of 7.5? And then I took OET when I first took the OET. That's when they introduced OET in 2019. So it's fairly straightforward. They judge you on your medical skills. So they'll give you transcription. Everything is based on medicine. So it's quite easy to take OET. So once you got your OET in your basket, now you're in internship and you are eligible to take Plab 1 at this phase. So as you all know, there's a lot of demand for Plab 1 seats. So try and get your GMC accounts online. Try to give your English test as soon as possible, and then try to book your Plab 1 seats. So now let's say you finished Plab 1. Yeah, a lot of my colleagues recently have been waiting for Plab 2 for 6 months. Trust me, it takes 6 months to even a year. But given this winter application window, so you've got this FY2 standalone programs or foundation training programs applications opening in January. So there is a way to circumvent this process to get a GMC license or your PLAB 2 seats quicker than the other candidates. If you're applying for foundation training and if you passed PLAB 1, if you got a job offer, essentially, they will give you a seat earlier, if that makes sense. If you got a job offer for a foundation training program, which is FY2 standalone, you have a chance of getting your PLAB 2 seats earlier than others. So they prioritize you if you got a job in your hand. So try to do that. Look into for FY2 standalone programs if that is a shot, because you've got your winter applications coming. But the other option I would suggest, if you finished your internship and if your internship is not part of your MBBS, let's say they give you your MBBS degree after final year, you are eligible to sit MRCS or MRCP Part 1. So try not to waste your time for like 6 to 8 months or 1 year sitting for just a plateau seat and then thinking about what to do. I would suggest sit your membership exams, because that will give you more chances of landing your first NHS job when compared to others, because nowadays everyone is coming in with higher degrees, MScs, MRCP. So utilize this 6 to 8 months after your PLAB 1 very smartly. That's what I would say. So now you've got your PLAB 1. Thankfully or luckily you got your PLAB 2 seats. What you need to do, you try and get a visitor visa. And one thing, I'm not going to go deep into your visa applications and stuffs here, so I'm just going to one thing I'm going to say in your visa application, just try not to mention that you're coming to UK to attend an academy. So they try to reject most visa applications because GMC doesn't recommend any academies. Just put your visa as a visit visa, visiting a friend. That's it. That's all I want to talk about visa. And then you come to the UK as a visitor, and then you take your courses. There are a lot of different academies. I'm sure you can find it on Facebook about all the reviews of them. I personally took Manchester because it was close to the GMC headquarters, so I took an academy there. So after taking your academies, the timeline for your preparation for PLAB 2, I would say, would be when from the point when you reach UK, it would be 6 to 8 weeks maximum. That would be the time for you to prepare in UK, but always you can take online courses before that. So after 68 weeks of preparation, you get your PLAB 2 exam sorted. So after PLAB 2, what you might do, what you are thinking to do, I would say take an elective or an observership whilst you wait for your PLAB 2 results. In that way, you're not wasting your money in terms of flying back to your country, and also you have time within your visitor visa 6 months period, so that try to arrange your electives or clinical observership, which will help you to how the NHS works, and then it will be useful for your NHS jobs. So use this time when you wait for PLAB 2 results to attend clinical observership electives. So now you've got your clinical electives done, you've got your PLAB 2 exams done, you passed the exams. Now what should I do? So now you've got your GMC account online, you just open it, you've got your PLAB 2 results. All you have to do is follow the steps of applying for your medical registration. This is the point where they ask for that epic verification or the epic ID number which you did, between Plab 1 and Plab 2, because it takes a lot of time, guys. To try not to waste your time and leave that in the last minute and okay, fine, I'll leave it. And then after Plab 2 results, if you start applying for your epic verification or your primary medical qualification, these guys will take a long time to communicate with your undergraduate university, and it'll take like 6 to 8 weeks or more than a month. So try to get that done between Plab 1 and Plab 2, like shown on the flowchart, so that you save a lot of time. And then when you apply for GMC registration, you can just type the EPIC ID and that's done. And then they'll ask you to explain sort of gap years. Let's say you're doing an internship and you're going back to India, or you have something like a family emergency, or you're taking time to prepare for FMG. It is completely acceptable to explain your time or gap years. We call it gap years after your undergraduate qualification. So even you can say you've traveled for 6 months, nobody's going to ask you. All you have to do is be honest. And if you say you're working, try to provide certificates from your private hospitals or wherever you're working in India or wherever. So make sure you get evidence of for anything and everything that you do, guys. In UK, everything is documentation, everything is paperwork. If you don't show something on papers, it means that it's not done. So make sure you get certificates for whatever elective that you do in your undergraduate or whatever job that you do. Make sure you get certificates, because this will become like a blockage for you to get your GMC registration. So make sure you get certificates for all your jobs that you do, and be honest and explain your gap years very clearly at the first time when they ask for you to apply for GMC registration. So now you've done your GMC registration. Next thing is getting your first NHS job. So if you're someone who's applied for foundation job, foundation training, they will give you a window to pass all these exams, Plab 1 and Plab 2. That's why they open these applications in January, so that if you're already past Plab 1, you just have to like finish your Plab 2 before August. The training job starts only in August, the foundation FY2 training. So it starts only in August, so you can use that window for the next coming months to finish all of your Plab 1, Plab 2, and make sure you land a job. Don't worry if you don't get the training job. If you can always apply for a non-training job, which like I did. I couldn't do this winter timeline, so I took my Plab and all during the summer. So I applied through track jobs and I got my first job. So all I would say is there's always a way around. Try not to get disheartened. So after your GM's registration, you got your job. You have to, if you're in the UK, you have to go back to your home country to apply for a Tier 2 visa, and only then you can come back to the UK with the now they call it a skilled worker visa. So that's all of your journey in a nutshell. There are a lot of in detail explanation for each step, but I just wanted to give you an entire perspective in a nutshell, so that you can plan your journey and have an overview sort of what you're going to do for the next 6 months to a year. Any questions so far? Uh, Otherwise, I'm just gonna go in depth with regards to financing and how you plan your journey. Any doubts, guys? Yes, someone's raised their hand.
Hello, good evening. I want to ask Plab 2. So, how difficult is it? Like, what are the, like, is there a pass percentage, or is there like criteria or something like that?
So, I mean, with regards to difficulty, I can only talk statistics, because each individual's comfort zone is different. If you're someone who's comfortable with patient interaction, patient communications, and in your university, if they have these OSCEs type of stations and settings, you will be starting off in a comfort zone. But I mean, take it from me. I'm someone who did my undergraduation in India. I had no sort of experience with regards to OSCEs, like, introducing yourself and then doing all those uh, aseptic precautions like you see in geeky medics. Uh, there's nothing. It's basically, as you know, in India, it's just a exam, viva. You sit in front of an examiner, you answer questions, you examine patients, and your PG helps with everything. So I'm someone who's from a background who had no exposure to OSCEs, who knew nothing about patient interaction or communication skills. So even if you know nothing like me, you can pass. And if I can pass this exam, anyone can pass it. So all I'm saying is it's an individual perspective. And to answer your question, it is an easy exam, but it needs the kind of effort that you need to put for that kind of result. So the pass percentage with regards to statistics is more than 65 to 70%. So the pass percentage for Plab 1 is a bit higher. Plab 2 is around 60 to 65 percentage. And most of the academies that you practice in UK gives you all the previous years, like, stations that have already turned up in the GMC exam. So don't panic, and then don't try to judge what it might be. I would say take one step at a time. Finish Plab 1. When you're at Plab 2, there'll be a lot of people in the same boat like you, like me, who knew nothing about Plab 2. And then I knew about everything in the academy. They'll teach you step by step, and it'll be like a spoon feeding, I would say, in academies. And then all I would say right now is try to focus on your, patient interaction. Be empathetic to your patients. Reflect on their pain. If someone says that, they are in pain, just try and reflect and then talk to them. And all it's all about patient communication. So try not to worry. It's not They're not going to judge you a lot about, is this person very sound in terms of managing this clinical skill. No, it's a balance between communications skills and your clinical skills. I hope that answered your question.
Yes, thank you. Thank you so much.
Anything else? Any other questions? Okay. So moving on to expenses. So this is the main thing that you guys need to look in, and I've just correlated with the British pounds with INR as I plan my journey with INR. So the main reason is it kind of gives you a gravity, sort of, what you're going to enter for the next 1 or 2 years, because this journey is going to take like almost a year for you to get your first payslip. So try to plan everything. So I've split the entire journey into three bits. Yeah. So as you can see on the slide, the first thing is from IELTS or OET until your Plab visit in the UK. So OET is a bit more expensive, as you can see. It's around 34,000 rupees with comparison to IELTS. But I mean, in the hindsight, if you ask me, guys, I would say, personal experience, I would say go for OET, because I've taken IELTS. I know how it is. But if well and good, if your English skills are good, if you're grammatically sound, I would say take IELTS. It's not a big risk. But OET for sure short. I took it the first time and I cleared it. And it's a bit expensive, but it's worth the investment. Plab 2 is around 240 to 250 pounds. It's around 25,000 rupees. Plab 1. Plab 2 is a bit more expensive because it involves you coming to the UK. You will have real life interaction with patients who the GMC has to hire, and trust me, they are like proper actors. Like in my station in Plapto, I had to, convince a really angry patient who broke out into tears, and like it's like next level acting in terms of Plap2. So always try to focus on your communication skills, I would say. Coming back to Plap2, it's a bit more expensive because it's more labor intensive, and they recruit a lot of patients, and it's really high fidelity. So in terms of cost, it's 92,000 rupees to a lakh. Visitor visa, standard visa without any priority applications, is around £100. 10,000 rupees. The EPIC verification, which you have to do for your undergraduate MBBS degree verification, is around 25,000 rupees to 250 pounds. So in total, for you to come to the UK in the visitor visa with all these steps, English exams, Plab 1, Plab 2 exams, visa applications, and EPIC verification, it'll in total approximately, I think it would take around, with the current cost increase, it would come around 1.5 to 2 lakhs maximum. It wouldn't cost you more than 2 lakhs, 2 lakh rupees. So now you're in the UK, you're given your PLAB 2 exams. So what is the cost from PLAB 2 until your GMC registration? So I've included the tickets and everything. So I think this gives you an actual real life weightage, so that you don't have to think outside the box. So it's basically 700 pounds to around 800 pounds now right now, because the prices have gone high from the time when I visited. So it's around 770,000. If you want to travel comfortably, it'll take you around 80,000 to 90,000 rupees for a round trip plane ticket. So it's around a lakh, I would say, now right now with Emirates and everything. So PLAB 2 course, the course in academy would cost you around 550 to 600 pounds. I think this would be around like 4 weeks course, I think. I'm not entirely sure. There are the academies can give you a comfort window sort of to practice everything with the mannequins, with the cannulation, catheterization. They have all the dummies in the academies, so they'll provide you everything. You don't have to worry. So it's around 600 pounds. And the course that I attended was around 15 days to 20 days. And then that is the pivotal area where you make a lot of friends, you meet a lot of people from overseas. That's when you need to make sure you find the right practice person, because most of the communication skills rubs off from the friend that you kind of practice your stations with. So make sure you tag up with a nice communicative partner in terms of your PLAB 2 course. That's the only thing that I would add on in terms of PLAB 2. But otherwise, it's fairly reasonable price to attend academies, and I would recommend definitely attending academies. The rent and living expenses in the UK, when I came in, I was paying around, it depends, guys. If you want to take an academy in London, you need to have more funding. If you want to take an academy in Manchester, it's a bit cheaper than London, because more south you come down, it's a bit expensive. But also plan the location, because you have to give your exam. If you take an accommodation in London, you have to travel all the way to Manchester, because the exam happens in Manchester GMC building. So plan your expenses, plan your academies based on your living expenses. And if you have relatives in Manchester, I would say take a house nearby Manchester. So the current expenses in London is around 600 to 700 pounds in shared accommodations, including bills, per month. So that would cost you, if you're staying for around 3 months, 1,800 to 2,000 pounds. Like it will be like anything. So easily spend around 2,000 pounds. I haven't accommodated the food expenses in this, so probably you could add on like about 150 to like 200 pounds a month for your groceries and everything, in addition to the rent. So GMC fees, and so that is when you apply after passing PLAB 2. So you apply for GMC registration online. So they have a fee around, I think it was around 160 pounds. I think it's still standard. Standard fees around 17,000 rupees. So in total, guys, it's around 3,500 pounds, I would say, in maximum comfortable zone. If you want to be in like 3 lakhs to 3.5 lakhs is enough for you to stay and then spend your time in the UK, do electives, do observerships, and then it'll cost you around 3.5 lakhs. So finally, try it. So you finished everything. You passed your exam. You've gone back to whichever country you belong to, and now you are trying to, you got a job as well. Now you're trying to apply for tier 2 visa and starting your job, first job, and the point before, your first pay slip. So if you're from a country, tropical country, you might have to get a TB clearance certificate. This for me, it costed around 2,500 rupees in Apollo. And then police clearance certificates, I think it's a bit cheaper, 2,000 rupees or 1,000 rupees, it depends. And then Tier 2 visa, it's 240 to 400 pounds, depending on the priority application that you put in. And then a one-way plane tickets, it's around 500 pounds, 550 to 600. And then the startup money, because you won't start your job straight away, because after coming to the UK, they will do pre-employment checks in the hospital. They will take blood tests. You will have to wait for your British resident permit, and you'll have to wait for your right to work in UK. So during that waiting period after you come to the UK, it's around 3 weeks, maximum 3 to 4 weeks. And I calculated that expense as well in it, just so it gives you a realistic value. So it's around £1,000 to £1,500. The startup money that you have to have till you get paid. So it all comes to a total of 2.5 lakhs. So in general, 2.5 plus so 2 plus 3, 5.5 to 6, so 8 lakhs, I would say. I think I would say in general, overall you need to have, like, 10 to 12 lakhs, 12 lakh rupees for you from starting your IELTS to getting a first pay slip comfortably, with the minimum expenses, with you cooking at home and all your groceries and stuff. So I would say 10 to 12 lakhs is an overall expenditure that you can incur during this period. Any questions so far? Feel free to raise your hand if you've got any questions. Otherwise, I'm just going to head to the next topic, which is the most discussed topic in a lot of forums. All right. So the next topic is UKMLA. Is it replacing Plab, or what is UKMLA? Is it good or bad for IMGs? Will it be similar to Plab? Oh, I passed Plab on right now. What am I going to do? What if UKMLA comes in, and then what am I going to do? So these are a lot of questions. It's just circulating all over the social media and forums, especially because of the 2024 phased induction of this exam that's coming in. So I'm just going to address all of these questions today. Feel free to drop in your questions after this session as well. So essentially what UKMLA is, they're just trying to mimic USMLE, but then it's just a standardized assessment. So what the GMC says is that UKMLA exam is mainly designed for the United Kingdom medical students. They're going to use this exam as like a final year assessment for them to gain a license to practice. This is going to be rolled out to them only from 2025, but then they're going to do a phased induction for international medical graduates from early 2024. So is this good or bad for IMG's? Personal perspective, I would say I think it's going to be a fair point, because it's going to give a equal footing for both of the international doctors and also the local doctors, because we are going to be equally assessed. The playground is going to be the same. There's not going to be any discrimination in terms of, previously it's just for us there's this Plab exam, and then we have to get all these licensing, all these payments, and all these extra certificates and stuffs. But now it's going to be like a basic, common, standardized exam. Will it be similar to Plab? I think it's reasonable to say that there might be new changes to accommodate, but almost it might mimic the same Plab pattern. So I'm just going to give you a basic structure of what the UKMLA is, and what are the structure, because it's almost similar to Plab, I would say. So this has two parts, AKT and clinical and professional skills assessment, which is nothing but similar to Plab 1. The first bit is the multiple choice exam. Maybe they're going to increase the number of questions. I'm not quite sure, because GMC hasn't released any guidance on it yet. And the second bit is also a practical exam like Plab 2, which is the similar OSCE stations in terms of Plab 2. Also, you might have heard other terminologies in your universities like OSCE or OSLR, which is the objective structured long examination, or like clinical examination stations, like you see on Geeky Medic videos. So the most recent update on the GMC website says that for now, until the end of 2023, it's going to be Plab. It's going to be the same old structure, same old pattern and everything. From 2024, I'm not sure which month, but from 2024 onwards, it's still going to be Plab for international medical graduates, but the requirements or the structure or the prerequisites, that's basically, to put it into simple terms, the way they deliver the exam for us will be matched with the UK MLA guidelines. Uh, Essentially, they're trying to cover the topics that they're going to cover for the UK medical graduates. So it's I think it's going to be the same. And in the GMC website, it still says for international medical graduates, even from 2024, it is going to be Plab. The name is not going to change as of now. The structure is not going to change. Only the basic underlying concepts. They might add or delete a few topics like medical topics or surgical topics. Otherwise, according to the recent latest guidelines, it's still the same Plab exam with a small phasing in of the small requirements that the UK MLA exam or a blueprint. Basically, blueprint is going to change in terms of the topics. Otherwise, it's still the same, guys. Don't try to panic. Don't worry. Take things as they come. Do one thing at a time. If you finish, so now let's say you finished Plab 1 in December 20. Now, always we ask these tricky questions, Let's say you finished Plab 1 in December 2023, and then you have to book Plab 2 in 2024. All they're saying right now, it's still going to be Plab 2 for you if you finished 2023. It's just the topics and the basic concepts and structures of the exam that's going to slightly change. Otherwise, it's not going to be UK MLA. It's still Plab. It's still going to be called as Plab. That's the latest guidelines, but things can change in the next couple of months towards the end of the year. So always keep an eye on GMC website. Try not to follow any blogs or websites, because they might try and mislead you. I would say always follow the GMC guidelines. There is a separate subsection which clearly explains for international graduates, and all these information that I've presented today is taken from the GMC website with regards to UK MLA and the frequently asked questions. Any thoughts? Any questions after this? Because I'm just going to compare USMLE and Plab and stuffs, and then give you an idea of my personal journey after this. So any questions right now with regards to UKMLA? Okay, so I take it that there's no much questions right now, but probably I'll come back to this topic. We'll revisit this topic later at the end of my presentation. So why USMLE? Sorry, why Plab and why not USMLE? This is just my personal perspective. Initially, we had a lot of 2 to 3 steps in USMLE, I guess, but now they've changed it into 2 steps, and previously it was a pass. Sorry, you had to get high scores, but then now I heard that they've cut down to like just passes enough in terms of USMLE. But me personally, I planned my journey when I was in third year in MBBS, and then I was thinking in terms of the easiest or easy in terms of the shortest route to landing my first payslip, because I didn't want to burden my parents, because it's a long journey for USMLE and you need to have a good financial footing. There's a lot of ifs and buts for USMLE. It's a long journey. You have to start. The good thing is you can start preparing in your undergraduate. If you're motivated for it, well and good. I personally wasn't aware of all these things until I came to my third or fourth year. By that time, I thought the only easiest way in terms of financial burden was Plab, so I took Plab, and also the exams were a bit shorter at that time, and then you could sit multiple attempts in terms of Plab, and The pass score was also a bit higher. And also the cost was a bit lower in terms of Plab when I calculated the entirety of the expenses. And also for USMLE, a couple of my friends had to do electives, travel to USA, and they had difficulty in terms of visa policies. And then one completely dropped USMLE, and he's now like a orthopedic trainee in UK. So he completely changed his pathway. So I'm not saying Plab is better than USMLE. I'm just saying it's personal perspective. It's my personal decision based on my family circumstances and my situation. So if you have a good footing, if you have a good financial setting, and if you are really motivated, and if you want to train really well, and if you and obviously you get paid more in US. But personal perspective, I think in terms of work-life balance, I would say I'm comfortable, and I quite enjoy my job in the UK. And contrary to that, I have a couple of colleagues in USA. They do enjoy their life, but then it's mostly a lot of slogging of so many hours in the hospital, and a lot of turmoils that I have to go through in the USA training. But this is a simple overview of sort of why I chose Plab in terms of a USMLE. And that's the end of my presentation. Right now, I'm just gonna talk through my personal journey. But before that, if you guys have any questions, I'm happy to take them.
Guys, does anyone have a questions? Kindly feel free to ask.
I have a question.
Yeah.
So you said that we have to register for the prerequisite GMC registration while doing internship. Basically after the medical degree, so we cannot do it before that.
So it depends on your MBBS, because there are certain universities who say that, who provide your MBBS degree, and then the internship is only like a postgraduate training. So for like in UK, the foundation year 1 is basically after they have graduated. It's so internship is just like a job for them. But there are certain universities which give you MBBS degree only if you finish internship. So how does your university do it?
We get it before the internship.
So okay, so you get your MBBS degree before internship, right?
Yes.
Okay, so it's quite easy for you. So you already got your MBBS degree, yeah. So now you can actually like verify it. You can verify it with Epic.
Okay.
But before that, try and check if your university, I mean, if you've got seniors already working in the UK, I'm sure your medical school will be already there on the World Directory. But I would just double check if I were you. Just go to the website of the World School Directory and then check if your medical school is already there on the website. If it's there, it's very comfortable. If not, just try to communicate with GMC.
Okay.
But to answer your question, yes, you can do your Epic verification even now, if your school is already recognized, and because you already have your MBBS degree certificate, you can do your Epic verification even now.
Okay, thank you.
Okay, so I'm just gonna finish off my presentation, and then resume back to the questions, because probably if I give you an idea of sort of timeline, sort of how I did everything, you might be able to relate with my journey. So I'm just gonna talk to you about how I started off, and how my timeline was, and what are the difficulties that I faced. So basically, to start off, it was, I think, when I started thinking of Plab, it was in my pre-final year, third year. So I thought, okay, I wanna do postgraduate training outside India, because obviously, you know, I wasn't happy with the work-life balance in the UK, and how, sorry, not in the UK, in India, and how, you know, post PGs were treated, or like, you know, how the life of a PG in India was, and how doctors get beaten up and all those stuffs. So I started thinking about it, spoke to my parents, and then did some lot of research on it, and then it was 2019 when I did my when I finished my internship. It was 20, January or February 2019, and then I was preparing for my NEET exams, and at the same time I was preparing for Plab exams. I already finished my English exam during my internship. So I had my Plab 1 booking in I think it was in November 2019. So I finished my Plab 1 in November 2019, immediately booked for my Plab 2 in March 2020, because I had to give that gap window of 2 to 3 months for Plab 2 preparation. So I got my results of Plab 1 in December 2020, and then I flew to UK in just before COVID. So it was the end of February 2020. I came to the UK. So before that, guys, I don't have any medical background. My parents are not doctors, and none of my family members are doctors. So don't be taken aback by seeing this. You know, oh, this guy is like a senior teaching fellow, and he's got a strong footage in the UK. Trust me, I was just like anyone else, knowing nothing, didn't do anything in undergraduation, did not have any papers, did not have any posters, did not have any audits. My portfolio was zero. Yeah, my portfolio was like literally scratch. I had nothing on my portfolio. I came to the UK knowing nothing. And then I did not have any colleagues from my batch. So it was out of 150, 200 students from my entire batch, it was just me who made this decision. So it was a difficult decision to come to the UK because I had no friends or company to travel alongside me. So I came to the UK in February 2020, and then, as you all know, COVID happened. March 2020, COVID happened, and then all of the exams were cancelled. Um, so all I wanted to say is, you know, you can only plan so much in your MBBS. Like you can say, like, you know, probably you're hearing this way ahead in your MBBS, third or fourth year, or even your internship. I didn't have so much of exposure, so you can only plan so much. And then I also had a plan B, but then it didn't work out. Everything went down the drain. I couldn't go back to India because the flights were cancelled, and then GMC said because of COVID, patient interaction is difficult, and we couldn't take the Plab exams. I was a sitting duck in the UK. Trust me, I had no money in my hand. Um, I had no exams to attend. I knew no one in the UK. Trust me, this is like was the worst possible scenario someone could not even imagine, or like they couldn't have it as a plan B or C. So I was contemplating whether to go back to India because of the repatriation flights, and I couldn't go back. So I stayed in India, stayed in the UK with some money that my parents gave. Thankfully, I brought a bit of good comfort money, and then stayed in the UK for like 6 months. And then I'm not sure if you've been following before. So GMC resumed the Plab exams later in the year after. So I was in March, right? April, May, June, July, August. So of almost 5 months, there were no exam. And then I took my exam in September 2020. So it was like a pilot exam. So the entire structure of Plab 2 was changed. So there was no patient interaction in terms of, so there was no examination stations. They introduced new telephone communications. That was the first time they introduced such a station. So you had to do telephone consultations. So you have to do everything, history taking and everything from phone. So trust me, like someone asked how difficult Plab 2 was, and you know, how is the structure? Is it easy to pass? I was like, oh my God, I prepared this entire structure of exam for the last 2, 3 months. And then now they're coming and changing the patterns and introducing new stations. We were completely thrown off the track. All you had to do was trust your gut instincts and your basic MBBS qualification knowledge, and a bits and bobs of, you know, knowledge that you gained in UK. Obviously, they train you in the academy, but then it was all new. But we went in for the exam. in September 2020. Thankfully, luckily, I passed the exam, or passed all of my stations. Almost 16. They cut down the stations from 16 to 12, so I had a good score in all of 12 stations, and then I had to stay in the UK for 2 to 3 months because of the COVID, and contrary to the routine procedure, like I said before, you had to go back to your home country to get a work permit visa. I think COVID happened for the best, or I would say helped me in one way, because I didn't have to go out of the UK. I stayed in the UK. I was taking job interviews. They gave me offers, and then I didn't have to go back to India to get a work permit visa. So that was the first time in the history of the GMC, or work permit. They allowed us to work in the UK directly, um, without having to go back to the home country. So I started my job. It was quite okay. Started my first job as a F1, trust grade F1 in emergency medicine. So that's how I landed my first job in December 2020. And since then, I've been working on my portfolio. Because as you know, my portfolio was zero, uh, and now I've got the maximum portfolio points on my surgical application right now, and I'm applying this year in December. So, in the hindsight, if you ask me, if you know could you have planned all of this? No, nobody could have planned anything, or planned plan B or C. Nobody could have expected COVID. No one would have known that I would have gotten stuck in a country that I had no footing or knew nobody. So, guys, if I could do it, I mean, coming from a background of no medical background or no medical support, from a village background, I'm sure all of you, with such an exposure, especially being a part of Namma medicine, and being, exposed to all expert panels of talks and experience and exposure, I'm sure you can ace any exam, and achieve whichever training job, or opportunities that you would like to achieve. So with that, I think I've taken more than the allocated times. Apologies for that, but I think I'm at the end of my presentation. Just wanted to finish it off saying that, just try not to focus too much on your destination, guys. I was doing that. I was too much, overworked up. I was too much fuming up. Oh my God, what's happening? I'm not getting to the point where I wanted to be. All I would say is try not to focus on the destination, just focus on the process.